A lot of teachers, salespersons, and trainers come into my clinic complaining of voice problems. Among the most common problems are, I cannot reach the high notes anymore, or I easily get tired of talking, or my voice cannot reach the end of the room. When I ask them how they have been taking care of their voice, they usually reply that they're not conscious of the way they have been misusing or abusing their voice. Today, I'll be discussing the different ways in which you can take care of your voice. First, make sure that you have adequate hydration. Think of your vocal cords as a car engine. There are hundreds of moving parts inside a car. Each of these parts move against each other and produce friction. As your car engine needs oil, so does your vocal cords. If you don't drink enough water, your voice will suffer, and this can cause other problems such as vocal cord nodules. One way to check if you're adequately hydrated is to check your urine. Ideally, your urine should be clear as water. Avoid drinking coffee, as this can make you lose water content. Second, maintain good posture. Think of a musical instrument such as a violin. The shape of the instrument is created to make it produce a beautiful sound. As a singer or a voice professional, your body is your musical instrument. When you have good posture, it helps your breathing mechanism and it helps you relax, and overall, it makes you use your voice properly. When standing up, make sure these body parts are aligned. Feet to knees, knees to hips, hips to shoulders, and shoulders to ear. To center your balance, place your feet shoulder width apart and lean forward slightly. Make sure your weight is on the balls of your feet. You may place one foot in front of the other if it makes you comfortable. If you are sitting, sit as far forward on the chair so your feet are solidly on the floor, about shoulder width apart. Relax your neck and your jaw when singing or speaking. Third, practice good vocal habits. Some voice coaches advocate voice exercises while you're preparing for work, in the shower, or when driving to work. Fourth, always be conscious of the quality of your voice. As much as possible, when speaking, do not use a high pitch or a shrill voice, as this can cause tension on your vocal cords. Think of a violin or a guitar string. When it is strung tightly, it produces a higher pitch compared to when it has less tension. However, the use of an unnatural low pitch is also discouraged. Learn to speak using force from your diaphragm instead of your voice box. 5. Conserve your voice. Do not talk when unnecessary. Do not speak in loud environments if possible. If you can, face the person you're talking to, or use a lapel when speaking to a large crowd. 6. Treat underlying medical conditions such as acid reflux or gastroesophageal reflux disease. Acid does not belong in your throat, and it can irritate your vocal cords. 7th, have a healthy lifestyle. Sleep well and eat right. Fatigue can have a negative effect on your voice. Exercise regularly, as this can help with breathing and posture. Again, this is Dr. Ruth Estimar reminding you to take care of your voice.